First of all, thank you, Pelle and Marika, for inviting me to Finland. I think it's a great initiative, and I hope it will we'll see each other next year. I think it's very important that the public and the private companies meet in these seminars and sessions, because you can't live without us, we can't live without you. Especially talking about welfare technologies. Den der. Ja, det går. I'm sorry. Can I use this, please?
Yes.
Yeah, thank you. Well, first of all, let me introduce myself. I am Lars. I am senior consultant in the Municipality of Aalborg. I'm working in quite a new unit. We call it a quality and innovation unit. I've been working in the elderly services for 26 years now, and I'm so privileged to be working full-time with innovation. Why are we talking about quality and innovation in Aalborg? We're talking about quality because we have some challenges, I would say, in about the health sector. A lot of things they did in the hospitals. We are now doing in the municipalities. And about innovation, we talked about it, and thanks to the speakers before me, you have enlightened me, especially about implementation and evaluation of the welfare technologies. Now, my talk today will be in 3 parts. I'll just introduce you to Aalborg. I'll tell you about how we work with the public and private cooperation in Aalborg innovation-wise. And then I'll just show you and talk about the nursing home of the future that we built, which opened the January 1st, 13 in Aalborg. This is my town. I love it. The 3rd largest municipality in Denmark, and we are very proud of it. We had a reduced. Oh, sorry. We have reduced the number of municipalities in Denmark from 275 to 98, and at that time we became the 3rd largest municipality. We are I think more than 210,000 people now, whereof 40,000 people are students. On the university alone, there are about 21,000 students. We are a very big convention city. We have a lot of national and international conventions in Aalborg, and we have a very, I would say, rather international airport. I would say that, with daily departures to Istanbul, to Amsterdam, to Frankfurt, to London, and we're very proud of it. We don't need to go to Copenhagen anymore.
What about Helsinki?
Not to Helsinki yet, but believe me, the Department of Care for the Elderly and Disabled, where I am, the leadership is Alderman Thomas Kraup and Director Jan Nielsen. We have 6,500 employees. We have a budget on 3 billion Danish crowns, which is equivalent to 400 million euros. So it's quite a large. This is the largest department in Aalborg. We have 41 nursing homes located in 3 different districts in Aalborg, located in small communities and in the inner city of Aalborg, and the politician is very keen on keeping the smaller nursing homes in the villages around Aalborg. Last time we discussed the budget, they were trying to close 2 smaller nursing homes, and that gave a very big row from the people in those small cities. So they dropped it this time, but maybe next time. We do nursing. We work closely with the practitioner doctors and the hospital. You could say that in a way the services concerning nursing is very close with the hospitals nowadays. A lot of people is elderly, especially, is not in the hospital for very long, so we take them back to the home, and together with the hospitals we manage the further treatment of the residents. In Aalborg we have a large capacity of training activity, generally for the elderly, and concerning dementia, which is all over the world a challenge. We are now building the second entirely dementia nursing home in Aalborg, inspired by the De Hogeweg in Amsterdam in Holland, if you know it. If you don't know it, please visit it. Not because of the buildings, but because of the way they care for the demented people. We have a lot of home care, as you heard from the director here from Voluntary. It's quite the same challenge. Could we provide financially and also in matters of staff members enough nursing homes? So we don't believe we can, so we have to develop the home care. We have 98% of what we are doing in Aalborg on elderly service is provided by the municipality. Not like in Finland, where there's a lot of private companies in Aalborg and most of Denmark. It's first and foremost the municipality that provides the services. Now I talk to you about welfare innovation. I had a short discussion with Dennis yesterday. I love welfare technologies, and I love people. And what comes first? I feel that people come first and before technology. Technology should be something we use connecting directly to the people, and the people should have a lot of saying in using technologies. And that's also what I hear from other municipalities and nursing homes using technologies. It's a challenge every time to implement new technologies, because a lot of people should be involved in the implementation. When I talk about welfare innovation and welfare technologies, it's very important for me to stress that due to the financial possibilities in Denmark, in Aalborg, we should take very good care in describing exactly what we want and what we need of welfare technologies. Just to buy the technologies and say, okay, that looks good, it's smart, it works, but we should be very careful, because the financing is very, very hard these days. No one wants to pay higher taxes in Denmark. So as we are turning every coin in other aspects, we are also turning every coin in matters of technology. So it's very important for us to cooperate with private companies. We're the market for for the private companies, and you are the deliverance for the best possible technology. So we can't afford to make any errors. I talked to Dennis last night, and there's been a tendency to, when we are talking about welfare technologies in Denmark, there's been a lot of projects. We have a lot of funds earlier in 6-7 years ago that gave the municipality possibility and financing projects concerning welfare technologies. But what we saw was that a lot of those projects didn't really stand in time. They stopped because maybe the technology wasn't good enough, maybe the implementation of the technology wasn't good enough. So we have to get in dialogue with the private companies. You have to come to us and ask, what is it really that you want? And then we can make it together. So in Aalborg we have a lot of cooperation with private companies. It's quite funny because a lot of those technology companies on welfare technology is quite small in Denmark. It's about 3, 4, 5 people employed in these companies. So it's very hard for them to by themselves develop the technology that is really useful in the municipalities. So we have in Aalborg 3 bottom lines that should be accommodated by the technology. The citizen, the residents, the users should be experiencing a higher quality. Not more time, but a higher quality. The staff members should experience a better working environment, that heavy lifting, so forth, is making things easier for them. And third, we must have a focus on an effective and cost-conscious organization, and that means money. So every time we are investing in welfare technology, we have to have these three topics fulfilled, or else it won't work. You could talk about the money. Is it very important that, is it really important that we save money when we use welfare technologies? No, not necessarily. But the resident, the citizen, must experience a better quality of life, or the staff member, both should be experience better quality also in the working environment. You talked about yesterday about the WTA, the Welfare Technology Assessments Model. We are implementing this model in Aalborg as well, and we have 6 social workers, social and health workers now who has an education in welfare technology. We're using those 6, and that's not many. Remember, we are 6,500 people employed in the department. But these 6 are now working on different nursing homes in Aalborg, and the success in that story is then we give people on the ground that kind of education. We see that implementation and the use of technologies get higher. If it's one like me, I'm located in a central position in our department. It doesn't work that good. So you have to take people out of their daily life, working life, and get them another function, being part of facilitating, implementing welfare technologies. That's one of the ways to get quite successful. Another thing is maybe to not create but be a living lab in your daily routines. Prepare your organization to always be able to take new technologies in, work with these technologies in a period of time, and make it the daily life. Our area of public service can be quite hard to change, because you have to change not only you using welfare technologies, but you have to change in thinking, and your mindset must be different than it has been. And that's very important. You don't do that in one day or 1 year. You do it continuously. You work with this all the time, and you can't set a date for stopping this or a date for beginning this. You have to work within this all the time. So in Aalborg we have a living lab. The first living lab was located around Nursing Home of the Future, but now we're working in different locations in Aalborg. And I'll just show you one case on public-private cooperation that has been very giving for us and for the private company. This is I'll just before that, I will just tell you about this. This must be a genuine user-driven development, and we have to integrate research and evidence from the universities and other educations that we have in Aalborg, and we do that. And the university and university colleges and so forth are very keen on helping us in documentation evaluation. I'll just tell you about this case. This is Robert. This machine here is Robert. It's made by a local producer called LT Automation. That is a really inventing business. They're quite nerds, I would say. Lars, who's the owner of the company, is married to a physiotherapist who is working at the hospital in Aalborg. And she came back to their home and talked to Lars one night and said, I think it's very hard for me to do these rehabilitation practicing for people who have maybe a broken arm or broken hip, or continuously movements all the time. And Lars said, okay, we're inventing a machine. He has a patent, patent on this this machine, and this machine are able to move as you would as a physiotherapist with the patient. The way we did it was we invited some of our residents and therapists, caretakers, and the university to, for some days, work with this machine in the Nursing Home of the Future, as a matter of fact. And Les and his people get the right ideas to develop this machine further. So now this is working around in the world, really. It's quite expensive. We didn't buy anyone in Aalborg, and don't expect that because we are developing with you, we'll buy it all. That's not the case, necessarily. But this is just a very good case on how to work together with public and private companies. And for Aalborg, we invite private companies to get in touch with us. We don't talk money, well, not every time, we do, but not every time, talk money between us. But this is a very good example for the development of new technologies. The same company got an idea from one of our staff members, a consultant, one of my colleagues. You know, we have flush and dry toilets in several nursing homes. We are also planning on installing flush and dry toilets in private homes now. And there was one consultant, Sarah, who said, yeah, the flush and dry toilet is very good, but what if you can't get your trousers off and on? So that's very good point from her. So Lasse, he has a patent pending right now on a Melvin. It's called Melvin. And this Melvin could be set up within the toilet and could pull now your pants down and your pants up. I know in Australia, Nick, they're very interested in this machine. But that's just another example. We have tested this prototype with LT automation and made it useful for so that elderly or disabled people could use this kind of welfare technology. And now they can use the toilet. So that's just two cases on how we would like to work together with private companies.
Can I ask you something?
Yeah.
How do you get this one into the toilet?
This one is not for the toilet.
Okay.
This is the robot. This is the training device for physiotherapists.
Do you have a picture of the one?
No, because the patent is pending, so I can't show any pictures of it. I talked to him just the other day and he couldn't get. I would like to send you a picture when I got it. He has just made a wonderful material to send to the world. He's just waiting for the last call. And then to the nursing home of the future, it's located. I'll show you where it's located in a minute. But when we made this nursing home of the future, we thought about the welfare technologies. We thought about it because we have analyzed how many people would we need in the coming years to be employed as a staff member in our nursing home. And we could see immediately that we didn't have that young people that should be able to get into these jobs. They didn't exist. And we know, as we heard from Vanta, that we had a demographic challenge in more elderly in the coming years. So we started to think about welfare technology, but also other things about the development of the nursing home of the future. We have 4 things that is very important. Something that is not depending on technologies and something that is technology. We would like to stimulate the senses. We would like to see people still using their senses fully when they are admitted to the nursing home. We talked a lot about mobility. How are we able to make the elderly move as much as possible? I have visited a lot of nursing homes of course in Aalborg and other places around the world, and sometimes when I see a unit in a nursing home, I see and I compare if there's 2 units. If I compare those 2 units, they look alike. They have the same facilities in each unit. We would like to make different facilities in this nursing home so we could ensure that people moved a little bit or have a reason to move a little bit more than maybe they did in nursing homes. And then we talked about inclusion, not only inclusion with the outside, with the society, but also inclusion in the house. People are different. You're not maybe social and you're not maybe social with your neighbors on the nursing home. You maybe better off pals with the people living on first floor, second floor, wherever. So we'd like to make a house where we didn't have any units, but instead had a house with 75 residents that could mingle through the floors. And then of course we had welfare technologies. I won't show you all, I won't talk to you about all, but we have Wi-Fi in every apartment, all over the house. The Wi-Fi is free for the resident. We have a waste suction system. We would like the waste from nursing home residents to be out of the house as quickly as possible. Maybe you understand why. And we have information screens to communicate with the elderly, and that was very important. The elderly could see in the hallways and the lobby and so forth what they should eat and what kind of activities there was in the house that day. And we found that when the info screens was down some hours of the day or one day, it was a very big problem, and the elderly came to the offices and asked, what are we doing today and what are we having to eat? So the info screens was very important. I know you have the same at your place. So the house is built in 2012 to 2013. It's 8,000 square meters, 75 apartments, all 2-rooms apartments. I'll show you the plan of one of the apartments. There's about 70 health professionals, and we have our own physiotherapists, occupational therapists, nurses, and of course social and health workers. We have a health clinic and a dentist located in the house. We have fitness center for nursing home residents. Yes, it works. I talked to Lasse, who was in national television Tuesday evening, by the way. He told the journalist, you have to be quick because I'm going to the fitness center. He's 92 and suffering from 2 brain tumors. So it can be done. We have a cyber cafe, we have a library, we have a restaurant for the residents, and a public restaurant. A very popular public restaurant. And the first restaurant on the north side of the river in Aalborg. So I'm grateful I'm living on the north side. And then we have thematic rooms, as I told you. Instead of have rooms alike in the house, we would like to have thematic rooms so we could push the residents to go and move around the house more than they perhaps would otherwise. The apartment is a 2-room apartment. The gross is 79 square meters for most of the apartments and 89 square meters for 2 apartments. The 2 apartments is for husband and wives. And I don't think they have any married couple right now in the nursing home, but they did when we started up. We have a little kitchen, a depot, which is very important, depot with a safe for the valuables. It's very popular with this depot because elderly people could have their, their Christmas things, their Easter things in this depot and could put them up when Christmas arrives or whenever they want to decorate their home. We got a bath, of course. We got a wash column that could swing, so the staff member could remove the wash column to the side and make more space in the bathroom. And we can take the wash column to the resident if they're sitting on the toilet, and when they're done, you know, flushing and drying in the behind, they can wash their hands at the same time. Of course we have smart floor in living room and bedroom, and as I told you, we have a IHC system, electric system, which means you can use your computer to control lamps and lighting in your apartment. And we have Wi-Fi. We have a wash column, and I mentioned Lars for you just a moment ago. Lars is 92 and he's still washing his own clothes. I asked him the other day when the television was visiting. Just a look inside one of the apartments. This is Knud. Knud is 90 years old. He moved in with his spouse, who was suffered very much from dementia. She is dead now, and now he is having this apartment with the most beautiful view over the river in Aalborg. And this is the locations seen from the other side, the real Aalborg. And this is on the left hand. It's the nursing home of future. It's located in a area that was dominated of heavy industry just 10-15 years ago, and now it's placed among very expensive apartments. Some of these apartments for Aalborg is quite expensive, about 1 million euro if you want to buy them. A lot of terraces, as you can see. This is another Lasse who's sitting here with his girlfriend. His girlfriend is not living in the nursing home, but they enjoy their view. Just some pictures from the nursing home, the cyber cafe, the restaurant. This is the nursing home restaurant, and just behind the plants there is the public restaurants. And of course everything is free for the residents here, and if they go on the other side they have to pay just like you and me. And the lobby with it, which is very much used by the residents to musical arrangement, lectures and so forth. The thematic rooms, we have a library, we have an orangery, and we have what we call the sweet kitchen. You can see them making small cookies, and we have a music room, and we also have a wellness where they can get their hair done and their feet done and whatever. And the meaning was, as I told you, this could be both give them a reason to move and also have a inclusive purpose. And of course they have rooms scattered around the house where they can eat together. They can eat in the restaurant, they can eat together in the communals, and they can eat in their own apartment. They decide for themselves what they would like to do. So just a presentation of assistive technologies, welfare technologies, whatever. The smart floor. We talked about the legal side of using smart floors. In Aalborg we have the interpretation of the law is quite strict in Aalborg. That means that if you can't get what we call informed consent of using the floor, we can't use it. And a demented person cannot give, according to our interpretation of the law, cannot give an informed consent. So unfortunately, we're quite locked in this in the law. I hope, and that was also the talk about with Dennis yesterday. I hope that the law will change, so you can make a nursing testament or testimony or anything. Today you can make a life testament. Maybe you can make a nursing testament. If you are getting demented, what are we then allowed to do about it? No doubt that this floor, and I'm not because we are here in Maricare and Mary Mills, or Palle is the host, but this floor does very good things. And you told from Hillerød and from Nøhr, you told about it yesterday, and we got the same experience. There is disturbance at night when you looked into the room, into the apartment to see if the resident was sleeping. This has been minimized, and only the people who need the visits will have the visits. There are some economic effectiveness in this also. You don't need that many night watches. If this was a normal nursing home and standard in Aalborg, as the politician has told us, there would be about 4 night watches. Now there are 2 on the job every night. A third will be called in if there is if it's busy. So yes, there are some money in it. Let me just tell you, we have to be in the municipalities. We have to be very careful to talk about this, about cutting staff and so forth, because when you implement, when you do these things, you have to be very careful. Don't believe in savings the first year, maybe the first 2 years. You have to implement this so it will work, and then you can harvest the savings. And of course the douche toilets and the Melvin, as I told you, is simply put in behind this dry and flush toilet, and will do this and pull your thighs. I wish I could show you. I can't. I can't. Not on me, but on film. And of course, we have a ceiling hoist system. We have the Goldman system. Others have other. And the reason why I'm showing this is that we, on all nursing homes in Aalborg, have installed the hoists, and that is very important. We have done for the staff members that their environment has been a lot better than it used to. And we can see in a lot of the lifting of people, we can see that we only have to use 1 staff member where we used to have 2. So just to finish my speech is the call for a broader, further cooperation between public and private companies to make the technologies that gives real value, human-wise, money-wise, and this should be my last word. Thank you.